Hey, good morning and welcome to UroNurse, live from the SUNA Conference. Welcome, everybody. It's myself live. It's Laurie live. It's Andrea live. We're all live. Trust me. If you're watching us live, great. It's been a great conference, and we've been having a great time. Andrea, why don't you tell us a little bit about what you saw here at the conference?
Thank you. So here at the conference, I got to see a lot of new products, a lot of old friends. I made a lot of new friends. The exhibit hall was absolutely amazing this year. It was very large. And I love going around and getting all the little goodies, the little flair, the little take-home gifts. So it's been really fun.
And Laurie, what did you think of the conference so far?
Oh, I think it's fantastic. Every year that I go here, or where the conference is, we have a great time. Definitely meeting everybody, seeing Vic and Andrea in person is always fun. Seeing the weather not as bad as what they had actually here where we're at, so we made it safe and everything's good.
Yeah, we were expecting a hurricane. Well, I guess it happened, but luckily no problem here. The hurricane blew right through and didn't do any damage for the Orlando area. Other parts of Florida, unfortunately, did get damaged. So it's been a great conference so far. We won the top prize for SUNA, the President's Trophy. So I'm really happy about that. Thank you. Thank you. And I did get a chance to go over to show you a little bit about what it's like to come and enjoy a conference. Andrea said how she liked the vendors, and we did meet some vendors. So here we go. Vic Senese from UroNurse, and Miki Ralph Lombardo. How are you doing?
Great. So good to see you again.
So as you guys know, we have an episode with the Elatone system, and they're one of our sponsors. So we're really glad to see them here at the SUNA conference.
Thank you so much, Vic. It's always great to see friends, and especially you. You're doing such a great work, and we're so proud to be a part of what you're doing. So thank you so much.
Well, we're glad to have you on board. Have you been to a SUNA conference before?
Yes, sir. This is probably our fourth or fifth that we've been to.
Great,
yes.
great.
We're excited because we're launching a new device for overactive bladder. So this is kind of like our launch session for the new device.
Good. Well, we're looking forward to having an episode on that new device.
Sure. Thank you so much. We'd love to be a part of it. And the response we've had with you and the our last episode was excellent. So thank you so much.
All right. Well, great. Moving on to our next booth.
Thank you.
All right. Hey, we're over here at the Sagent Glido. We know that Glido is a great product. We've had a couple of episodes on how to use Glido. And Matt.
Thank you, Vic. Matt Blasek, I'm the National Sales Director for SUNA Urology and Glido. Happy to support SUNA at their Urologic Conference. We've been a long-time supporter and really appreciate everybody's help making us now the market leader in lidocaine gel for the United States. So thank you, everybody, for your support.
Yeah, that's great. And they're also a supporter for UroNurse, which is even better. And I don't know if you know this or not, but I did a short on how to use lidocaine. So just a really quickie. I mean, we're up to 10,000 views. It's crazy.
It has helped us immensely, honestly. The short, for whatever reason, because it's from 8 minutes to 30 seconds, they get the idea on how to use it, so I appreciate it.
And it drives a lot of traffic to see the longer video on how to do it, but it was a good way to get people attracted to it and kind of see the simplicity of it.
Absolutely. Yeah.
I've been using lidocaine on my patients forever, but there was a product before yours came along that was made out of glass, and I had it break once in my hand, and that's when I met you guys, and I said, oh, this is it. I got to go to yours because it's plastic.
It's not going to break.
Not going to break.
Shatterproof plastic, and it's all assembled, ready to administer.
Now, the other stuff I had no problem with, except when it broke in my hand.
Well, thank you, Vic. We really appreciate your support.
All right, great. And, hey, we ought to have you on for another episode coming up.
We're ready. We can talk about Christy's study on using lidocaine gel for urodynamics.
That would be perfect. Yeah. So I'm going to put you down. I'm going to hold you to it. All right, thanks a lot. We're going to move on to our next booth. Did you ever have one of those things break in your hand, the old glass systems?
Absolutely.
Not to down, I don't want to make any bad remarks about another competitor, but that was the selling point for me.
Yeah, those were, and they're clunky, and they're just big, and
you had to assemble them.
Yep.
All right. Not just the fact that they were a sponsor, but I really like their product. and that's why they're a sponsor. All right, now besides going to just visit some of our sponsors, the SUNA organization has a foundation which provides a lot of funding for education. Sometimes you can't afford to get to a conference. You can actually get a scholarship for it. I got one a couple of years back, so it was really nice. So I did talk to the foundation people. Welcome to the UroNurse program. This is our SUNA Foundation. They do a lot of great things to provide funding for all sorts of activities. Is that correct?
Absolutely. Scholarships so members can come to the meetings. We do auctions so that people can come to the meetings, and lots of other educational opportunities for our members.
It's really great. And Fran, what am I going to win today?
Nothing, because I'm going to win it all.
As I recall, you won the big one last year, right? The Amazon.
So we have a Michael Kors purse, earbuds and a charging station, and a $300 Amazon gift card, which comes as 3 $100 cards. So good thing to sign up for.
It is. Yeah. You can't go wrong with Amazon.
Deal them out, right?
All right, well, good luck. I hope you get lots of donations. I know I've made a few myself. Yeah, I found out from my wife we've made a few more because she did go to the silent auction and she put her name down. So she will be winning something, I'm sure.
I'm sure it's one of the purses.
Andrea, did you get any merchandise? Or
I
because
didn't have
you're
an
leaving
opportunity
early,
to
right?
bid this year.
Oh,
Yeah.
well,
Yeah.
you missed out.
I did.
All right, let's go on to our next vendor. Here we are at Gemini, one of the supporters of UroNurse, and they have a great booth. Brian Hershey, we had on the show before, is going to be coming in later. Might be able to get him on the show, but Mike, nice to meet you.
Nice to meet you as well. I'm Mike Lentz, the Northeast Regional Manager for Gemini Medical Technologies. This is Heather Stacy, one of our clinical specialists.
I do a lot of urodynamics with the air charge catheters. The big problem that I've always found was pricing. I think you guys have a solution.
Yes, we do. We have a very competitive pricing point for our Atmos catheters, something that in many situations you'll find up to 43% savings versus the competition.
Absolutely. Well, thank you very much.
Appreciate it. Thank you so much. Thank you.
They're going to be joining us for an episode soon because I really have to say that you have to look at financials nowadays, and there is an advantage to looking around and shopping around for what you buy. All right, let's go on to the next thing. You know, one of the things I found as I went from booth to booth is products that I've seen in the past now have updates. There's something new about it. So it's just, this field is never stagnant. It's always something new.
I know, I always see something new with these.
Here I am at the Restore X booth, one of our sponsors. We're really happy to have them on board, and we're going to talk to Rebecca Cave a little bit about their product.
Thank you. Hi, we have a penile traction device for Peyronie's disease, post-prostatectomy, and for lengthening. Here's our traction device here. It is pretty simple to use. It's like a ballpoint pen, opens and closes. You make it a small configuration here. You open it, the head of the penis goes on the other side of the line there. You lock it in, you release it, and there's 3 pounds of force placed on the penis. You do the straight stretch for 15 minutes, and then you counterbend for 15 minutes. This is done twice a day, so it's a total of 1 hour, compared to 8 hours with our competition.
Excellent. And compared to other options that are out there, you've had good results.
Yes, we have. We have on our website is restorex.com. You can go and see all of our clinical results that we have on there, and testimonials from patients also.
All right, great. Thank you very much.
Thank you.
There's more. We're dealing with the delay of the internet here because I don't have my fancy office with the super high speed. I'm with Michael Cohen, Dr. Michael Cohen for Telecare, one of our sponsors on UroNurse. We're really happy to have them. And you're going to talk a little bit about your device.
Thank you. Thank you for coming around the booth here. Yeah. So here what I'm going to show you is this little device, the UriCap. And it's an external catheter for women. And I will show you how it works. It doesn't need any suction, no glue or tape. And what we found is that the silicone around here adheres to the skin around the urethra without any adhesive or anything. So you need to have close contact. So that's the important thing when you put it in.
Oh, let's try to get Dr. Michael Cohen on again here. Sorry about that. You know, we're dealing with shared Wi-Fi. I've got my super fast Wi-Fi at home. My granddaughter always says super fast. When I say you want to go for a boat ride, she says, "Grandpa, super fast."
Hi, I'm with Michael Cohen, Dr. Michael Cohen for Tillicare,
Maybe a little
one of
super
our
fast.
sponsors on UroNurse. We're really happy to have them, and you're going to talk a little bit about your device.
Thank you for coming around the booth here. Yeah. So here, what I'm going to show you is this little device, the UriCap, and it's an external catheter for women. And I will show you how it works. It doesn't need any suction, no glue or tape. And what we found is that the silicone around here adheres to the skin around the urethra without any adhesive or anything. So you need to have close contact. So that's the important thing when you put it in. So we have a little model here. There's a paper model for people, you need to educate. This is education. It's very important. Not everybody knows anatomy.
Absolutely.
Yeah. So to make it very simple, this is the opening of the vagina, and here's the urethra. When you have a catheter, you need to localize the urethra opening. You need to separate the outer labia and find the way to go. Here you don't. You're just enough to localize the opening of the vagina, and you hold, you guide it with your finger, you localize it, and you flip it in around the urethra, and you will then seal and protect the opening of the urethra from contamination. It's very useful when you want a clean urine sample and not using a catheter. And then you close the labia around. So here you have a little more sort of realistic model, so you can really see with a tube. And we put them together with a kit here with a tube and a water-based lubricant. That's what you need. You also need a little securement device to make sure that you don't pull it out by mistake. And then you just separate a little here, make sure you get full contact, flip it in, close, and that's it. So perfect for nighttime use when you don't move around, or if you're disabled, not having to straight cath at the night. It saves sleep, dignity. We even get stories now that you can put it in the wheelchair and you can go out. You don't have to risk being wet. So it also, increases quality of life. It's very important.
And males have had external catheters forever, but there hasn't really been any option for females.
No, this is the third option that women hasn't had, and no mechanics is needed. And the good thing here is that we have DME, we have reimbursement from Medicare, which is very important. So
now, one of the things you may not know is our program goes out internationally. I mean, we have viewers all over the world. And recently I had somebody contact me, I believe it was from Germany. Do you not have them out in Germany yet?
I don't have them in Germany. I have them in the UK.
So they were, right, they said they could get it from the UK or Ireland, but they had not been able to get it in Germany. So I did set them in contact with somebody from your company, and they said they would take care of them. So we have a worldwide audience, and we can get the supply.
We have them in Australia with Elite Medical. We have iMed Care in the UK, and we have Invent Medic in Sweden. So we have it inside the EU, and we hope to grow further and just becoming known. It takes time and persistent, but I'm really happy you came around. And
yeah, me too.
And this is something new, so you need all the training material. So here we have like a free course for nurses. We have all the videos and training material, which is very important when you have a new product in the market.
And that's why UroNurse was started, so we can get that training directly to them. We're going to get you guys on real soon again for another program to go over things.
I think we could discuss what's really been attractive is taking a urine sample, a clean catch.
Yeah.
And I think we could, that would be a great topic for, because that's an issue.
Yeah, definitely, yeah.
Non-contaminated urine samples.
A way to get one without having to catheterize somebody.
Risk-free and not contaminated. That's the way to go.
All right, great seeing you.
Thank you.
So we were just talking about that, how there's all these things that we've known about, we learn about, and then there's some new indication for it. And it's really kind of cool to see how much things advance in the field of urology. So what's got to be alive in it? What about you guys?
Sure. I mean,
Absolutely. I remember when our only option for an external catheter was the male Texas catheter. And now we have huge variety of options for males and females. And if we don't have to catheterize, we shouldn't catheterize to help prevent urinary tract infections and other complications. So it's very exciting.
and if I were a patient, I would prefer not to be catheterized. So bonus.
Absolutely. Man or woman, nobody wants to have a catheter put in unless you have to. So I got to ask you guys, how weird is this? Now we're live. There's people walking by. They stop and they wave and they talk to us. We are across from the bathrooms. I know you probably don't hear it because we were using microphones, but every now and then I hear this flushing sounds. But it's kind of weird working live when you're used to being in your own home, isn't it?
It's definitely, and it's cold in here. You know, conference centers are cold.
The only nice thing is I can actually reach out and touch people now.
Yes, of course, I have my UroNurse jacket.
Absolutely. And of course, I always wear my UroNurse.
I keep having to refrain because as people are walking by, I want to wave and jump up. I have to keep myself here.
So it is different doing a live show. We're working with it. I know we're dealing a lot with the internet. Hopefully you guys are getting a good signal. You could put something in the comments. I'd appreciate it that everything's working, but we're hoping it is. Fingers crossed. So here we got a couple of our experts here. Laurie.
Hello, everyone.
You're going to be there tomorrow for the show, 9:30 for the meet and greet.
Wouldn't miss it for the world.
All right, and Glenda Wilkinson, you work for?
Olympus America.
Olympus America, great company. Use their products forever.
Keep using them. They're wonderful.
So how long have you guys been supported for SUNA?
I've been coming since the 80s, and Olympus has been a member before I became a member of Olympus.
I think they're one of the longest standing supporters for SUNA. SUNA's a great organization. I'm a past president of it. Just won an award for SUNA's President's Trophy. So it's been a lot of fun. And it's always good to get to meet friends from before.
It is. It really is.
My young friends.
Made us all who we are. Yeah.
Well, great. I'm going to go and check and see a few more of these many booths that we have today.
Stop. Thanks for stopping by and visiting our booth.
All right. Thank you.
All right. Bye.
I love the fact that I get to meet people virtually all over the country. You know, people that you probably never would have met. But it is nice, the networking, to kind of actually see live people. It's kind of weird. Some of the people that have been on the show, they may have headphones on or different perspective. Then you see them live and you're like, whoa, I hardly even recognized you.
Right. It's nice also to there's hundreds of people here. How many people are here? And then the person you happen to talk to who's sitting next to you is local and lives right by you. I mean, that's even though they're all over, the United States. So.
Now, we have had some fans come up to us. People recognize us from the show. Have you guys had some experiences with that?
Absolutely. I got to meet a group of people on the elevator, and it was very fun and exciting to meet because I see the names come through and finally got to meet them in person.
I have not yet met somebody who's I've seen on. I'm assuming they're here somewhere, and hopefully I'll see them soon.
All right. Well, I'm sure you'll find your fan yet. Okay. Oh, we do have a comment coming in. Hey, from Puerto Rico. Hi, Puerto Rico's in the house. So I'm taking you're hearing us fine. I hope the show is working. Again, this live thing is always tough to deal with, but we have no other choice. I'm here, not in my office. All right. So besides going around and seeing the vendors, which is really nice, and going to the different shows and the lectures and things that we've done, I did one myself yesterday. I'm going to be doing one tomorrow. But I also went to the poster presentations. These are folks that have done research posters and they present them, and they are really, I always kind of almost feel bad. Sometimes they're standing around their posters. Nobody's talking to them. So of course, me, I got to talk to them. So here they go.
So here we are at the posters. We have this great poster on intrarenal medication installation protocol. And you are?
Christina Maruso.
And you're one of the researchers?
One of the nurses that worked on developing this protocol.
Great. Can you explain a little bit about it?
Sure. So we have patients that we treat with bladder cancer, with intravesical therapy. But for patients that have upper tract disease, that really is difficult to treat because when you go intravesical, you're not necessarily hitting the area where the diseased tissue is. Our doctors thought treating from above, from the kidneys down, would hit those areas of the ureter where the disease was. So the challenge we had is that there's not really a lot written on protocols and for nurses on how to give this medication or how to give any medication through the kidneys. So we worked with doctors and pharmacists to develop a protocol on how to safely instill medication from the kidneys with nephrostomy tubes that were placed just for this treatment. So that as it descends down into the bladder, we're hitting the ureters where the diseased tissue lands.
And the issue that you have when you're trying to infuse into the kidney is what?
So preserving renal function is a big one. So when you're instilling, you have to be very careful of the rate in which you instill. It cannot be on a pump because that pressure will destroy the kidneys, will affect the kidney tissue.
I would imagine pain too, like a renal stone would cause from the blockage.
Yeah, so our patients really didn't have pain from this. The pain came from the insertion of the nephrostomy tubes, which were placed specifically for this treatment. So about a week before we start treatment, they get nephrostomy tube placed. One of our patients had a solitary kidney, so of course our concern was, if we damage the kidney, that's it, they have one kidney. One of our patients had bilateral kidney disease. Again, concerned that if we damage the renal function, now we've interfered with both their kidneys. So we place the nephrostomy tube about a week before, and then we do a slow gravity infusion over an hour. It's a 50 ml bag over an hour, watching for any leakage, any discomfort to the patients. A really intense flushing schedule for the patients, teaching sessions for the patients on how to care for themselves after receiving BCG, but also caring for the nephrostomies, which they did not have prior to this. Yeah. So nephrostomies are placed the week before treatment. They get once a week treatment for 6 weeks, and then about a week after completion, we take those nephrostomy tubes out.
Very good. Now, you said you were nervous. You did great.
Oh, yeah, not good at public speaking, but this is something I'm passionate about. So.
There you go. I could tell. Thank you.
So if you're passionate about something, be sure to look up the UroNurse. Go to our website, look me up, hook me up, send me an email. Be glad to have you on the show. Sometimes you start out and you think, I can't do this. I'm too nervous to be on camera. You're a natural after a few seconds.
Hi, we're here at the poster that Jessica Simmons is going to speak about, called Investigating the Prevalence of Mucus and Sediment in the Urine from Intermittent Catheter End Users with Spinal Cord Injury through Self-Reported Real-World Data.
Hi there. So just to give you an overview, we looked at individuals with spinal cord injury that used intermittent catheterization. We recruited through patient support services as well as continence, intermittent continence.
Start that one. That was a crazy place for it to freeze up, but I guess the internet's slowed down a little bit on me. Let's see if we can get that to work. So it'll probably start from the beginning.
Hi, we're here at the poster that Jessica Simmons is going to speak about, called Investigating the Prevalence of Mucus and Sediment in the Urine from Intermittent Catheter End Users with Spinal Cord Injury through Self-Reported Real-World Data.
Hi there. So just to give you an overview, we looked at individuals with spinal cord injury that used intermittent catheterization. We recruited through patient support services as well as continence, intermittent continence catheter product distributors. I'm stuttering now. And the goal was to just have a better understanding of sediment, mucus, and urine. Who's seeing it? How often are they seeing it? And so what we found was almost 1/3 of the individuals reported seeing sediment or mucus in their urine and saw it at least monthly. Now, those who have history of a urinary tract infection, 2 or more urinary tract infections within the last year, now we're looking at 40% see mucus in their urine on a monthly basis. And then looking at sediment, well, we have almost half of the individuals are noticing sediment in their urine. And then if they have history of a urinary tract infection, that rate goes up as well. So it just it just is something more that we should be educating our patients to be aware of, that this could be a sign of urinary tract infection, and that there should be more vigilance.
So the second presentation that, are you done yet? Are you ready? We're live now. No, we're not live. We're recording this. So the second one we're going to talk about is exploring the quality of life in patients with neurogenic lower urinary tract dysfunction using real-world data.
So what we use here, we have a registry called ConCare, Continence Care Registry, and we have recruited individuals from the U.S., Canada, and the UK. And these individuals will take, once they're enrolled, they take surveys on a monthly basis within the first year. This is a longitudinal study that will go over a 5-year period. And then after the first year, then they'll complete the questionnaires on a quarterly basis. So currently we've got 192 that are enrolled, and we looked at a subgroup of individuals just with the neurogenic lower urinary tract dysfunction. And what we wanted to better understand, well, the whole registry, the goal for that is to better understand the overall user experience, quality of life, healthcare utilization, what drives them to choose the catheters that they use. So what we wanted to look at for this was perceptions of discreteness, and one of the questionnaires that we use is the intermittent self-catheterization questionnaire, and we narrowed it down and we just pulled some of the questions from the discreteness domain, and so we found that we found that 61% found that it was inconvenient to take enough catheters with them on a 2-week holiday. So portability is kind of an issue here. Discretion as far as being able to use their catheters outside of their home, only 69% felt that they could discreetly use their catheters. When we looked at just overall agreement that their catheter was discreet, 55% felt their catheter was discreet. And of this group, 45% of them are using a compact catheter, and only 55% felt that their catheter was discreet. And then when we also looked at disposal. So there's a significant amount of people that felt that disposing their catheter is also very inconvenient. So what was most concerning was we have 34% of individuals that have reported that their need to catheterize has prevented them or stopped them from activities outside their home, visiting friends, family. So this calls to action that there's a need for better support, clinician support, but also from a manufacturer point of view, an opportunity for improving catheter design, package design, to improve the user's experience.
Excellent.
Thank you.
Thank you very much. You got so comfortable with the mic and everything. I love it.
Karaoke. Yeah.
There you go.
Using a microphone. But hey, it's been really fun to get out and be live with you guys. And I know you're getting ready to go and see more of the exhibits. And this is a taste of what it's like to go to SUNA. It's really a great experience. I highly recommend it. But, you know, of course, when SUNA can't be here every day, every week, like UroNurse is, we're always here for you for your patient education for the healthcare workers. So any last minute advice you have for anyone at home, or? Sure.
I just wanted to encourage everyone, if you're interested in being a subject matter expert on UroNurse, everyone is welcome. There is no criteria. You can show up whenever you want. And so if you wake up in the morning and you're a little tired, you don't feel like showing up, you don't have to come. The only thing that you need is a little bit of courage to get up and talk in front of other people. But as you can see from all of the presenters today from the exhibit hall, everyone was a little bit nervous, but everyone did an excellent job of presenting. So I encourage you to join if you want.
Great. I agree with that. Laurie?
Yeah. When Vic said, "Hey, Laurie, you want to be on UroNurse?" I'm like, "Yeah, what the heck?" You know, the first episode, if you remember, I had a guy had my bed unmade in the background. And I mean, it's very new. And then it's come a long way. And yeah, if anybody can speak in front of of somebody. I mean, I would never thought I'd be doing this today. You get very comfortable and you don't need any criteria like Andrea said. And it's fun. And I do this because I want to. So if you're interested.
I think that's what's amazed me the most is the fact that, I talked you guys into doing this and starting this when I began 2 years ago. But the feedback I always get is I really like coming here every Saturday. It's fun to do. So yeah, I'm always looking for experts.
And you learn a lot. I mean, we may be experts in the field, but man, I've learned a lot while I've been doing it.
All right. So there's a plug. If you want to be more involved in UroNurse, hit me up and we'll put you on the show. All right. I got a little intro for next week's show.
Surgical site infections or infections following a surgical procedure. They can be superficial or involve organs and implanted material. These infections are associated with prolonged hospitalization, readmissions, need for further surgery, and even death. Proper skin preparation can reduce the risk of developing this. This presentation reviews why the skin prep is needed, how it is completed, and contamination risks. This presentation offers 0.5 credits. Join us next Saturday on UroNurse.com.
Well, I guess that didn't come out exactly, but next week we are going to have another one of our credit events. We're going to be talking about how you actually disinfect skin before doing a procedure. So I think it's kind of a necessary and good thing to talk about. And hey, you watch it, you'll get a credit. So join us next week for that. And I thank you guys for all your help, always. And I do see a couple comments coming in, so let's play those before I tune off here. Puerto Rico's in a solo urology nurse at an outpatient Veterans Affairs clinic that does it all. Well, that's fantastic. I think you're new to this, watching us. Looking forward to being able to use at the prep. Great. We're looking forward to presenting next week on that. So, yep, we're always amazed at how many new people we get joining us. And hey, we'll see everybody next week on UroNurse. Have a great rest of your day.